Here we go.
Thank you. Good morning, everyone. I'd like to call this meeting of the Cook County Public Health Human Services Board to order on this Tuesday, July 16th at 8:32 a.m. We have first item is approval of the consent agenda, which includes our agenda, the minutes from last month, financial report, abstracts and bills, a grant approval from DEED for childcare economic development. And is there anything a commissioner would like to pull or discuss off of the consent agenda, or any adjustments to the agenda itself? I hear or see none. Guess what happens next?
I'd like to make a motion to approve the consent agenda.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
Support.
Thank you, Rana. We have a motion and support. Any further discussion here? Hearing or saying none, all in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. Brings us down to our next item, the welcoming of new staff, Margaret Johnson, and I'll hand it over to Allison here.
Good morning, everyone.
Good morning.
Very
Good morning.
excited to be welcoming Margaret Johnson to the Public Health and Human Services team. Margaret joined us back on June 20th as the Eligibility Specialist within our Economic Assistance and Healthcare Programs team. Margaret comes to us from Sawtooth Mountain Clinic, where she served as a patient access representative and MNsure navigator. So Margaret is a bit of a unicorn in that she has some experience in the programs that she's directly administering in her role with the county, which is really unique for us. Margaret just completed her SNAP training last week. We'll be conducting and observing her first interviews today. So I'll hand it over to Margaret. If there's anything else you'd like to say, no pressure. You don't have to say anything at all.
I don't think that there's really anything else I'd like to say, but nice to meet you all. I've been enjoying my time here and soaking in lots of information. But yeah, like Allison said, it's good that I actually had some familiarity with all of the acronyms that I've been reading. So, yeah.
Thank you. We're lucky to have you, and especially with your skills and knowledge base already. So thank you for joining the team.
Thank you.
Let's see here. Moving on, we have our director's report, and I'll pass it back to Allison here.
Yeah, so I'll just start with acknowledging that we do not have a staff report this month. Just a little bit different for us. We will be presenting at the Committee of the Whole later this morning on some of our child care initiatives, and just want to acknowledge that, you know, it's a big lift for us to do 2 presentations in a month when our team is stretched. So we decided to defer the presentation this month just out of capacity concern for our team, but look forward to being back here in a couple hours to talk about our work supporting child care in Cook County. For my staff report this morning, I will start as always with an update on our staffing. An updated organizational chart was included in the meeting materials. I'll draw your attention to where we are presently with filling vacant positions. Margaret is our only new hire who has onboarded since our June meeting. We are interviewing, or have interviewed rather, for our in-home support program coordinator, our coordinated crisis response worker, our children's mental health case manager, and the new grant-funded public health educator youth prevention specialist. We have extended offers for all 4 positions. We did not have offers accepted by our Thursday agenda deadline, which is why you don't have any requests to hire on the agenda today. We do hope to bring forward hires at next week's regular board meeting on the 23rd. Since I'm not certain where we're at in terms of notifying candidates, this is all very new and unfolding. I can say that we, at this point, have had 1 offer declined, 1 is pending, and 2 offers accepted, both of these being internal candidates, which is a gift to have that institutional knowledge pass within the department, but also has the downside of creating 2 more vacancies within the team that will need to be filled. But we are seeing some progress in filling these positions. We are still seeing a low volume of applicants, a number of candidates referred to us, by the state merit system that aren't actively looking. They are outdated applications. They're people who aren't interested in relocating to Cook County, so still continuing to have some challenges recruiting for these vacant positions. Any questions on our staffing updates before I move on to department updates? Yes, Commissioner.
Yeah, thank you. That's wonderful news. Just to get progress, and the chart is filling in really, really nicely, and we have a solid team, so I'm excited. As far as the position that was declined, was there another applicant, do you know?
No, so we will be reposting.
Thank you. Maybe you said that and I just didn't hear it, but thank you.
Mr. Chair?
Oh, please. Yeah, Commissioner
Yeah,
Storlie.
thank you. So in interviewing with folks outside of the system here, is housing an issue with folks?
Absolutely.
Yeah. But the good news is there'll be apartments coming by next year, so that'll be a good step, don't you think? A first good step.
I do, and we have some energy within the team in terms of helping people make connections and find those limited opportunities that do exist currently. So everyone is very invested in filling these positions. They're really feeling the impact of the prolonged vacancies and the just frequency of turnover, both losing candidates to internal positions and externally. So it's really all hands on deck when it comes to helping support people relocating to the county.
Any other questions for Allison?
For our agency updates, I'll start with a quick summary on the financial report that was included in the agenda materials. This is our monthly report year-to-date through June 30th, 2024. All of our expenses and revenues are where we would expect them to be at this point in the year, with revenues being slightly behind just due to the incurring of expenses, the timing of reporting to DHS in our quarterly reporting, which initiates those reimbursements back to our department from the state. I'll draw your attention to the out-of-home placement line item. Our expenses are at 102% of the budget at $50,948 year-to-date. We are seeing a lesser amount of expense in June compared to the previous 5-month average, so that would indicate that we would expect this number to level out, not continue to increase. This, of course, is an unknown. We never know what might unfold with a family or in the community in terms of a need for emergency placement, but we do, based on current caseloads, expect this to stay steady. We did budget conservatively in this area and have budgeted for planned use of fund balance, as we do expect to go over that amount that we had budgeted. Any questions on that before I move on? Okay.
No.
We will be presenting our preliminary budget at the August 6th special board meeting of the Public Health and Human Services Board. Just want to keep that on your radar. That'll be our first look at the preliminary budget for the Public Health and Human Services Department for 2025. Our Public Health Fund Subcommittee, that's a subcommittee of our Public Health and Human Services Advisory Council, has been meeting frequently to review the requests for proposal for funding from local nonprofits or individuals in the community who are proposing a project and have aligned with a nonprofit fiscal sponsor. We have received 11 applicants requesting a total of $253,697 in funding. 4 of those are first-time applicants. So our efforts to incent new programs and providers through this incubator project has been successful, as we're seeing new programs and individuals requesting funding. We anticipate presenting recommendations for funding at either the August 6th budget meeting or the regular Public Health and Human Services Board meeting in August. Other department updates since our June meeting on June 25th, Cook County accepted a certificate welcoming our county into the AARP Age Friendly Network. We had a reception down at the Art Colony building on Highway 61. Representatives from AARP and the Quad A Arrowhead Area Agency on Aging were in attendance to honor the work done in partnership with care partners and in our public health team to better understand the needs and experience of aging community members.
Sorry, I wasn't there. Our meeting went till 11:30, and
Yeah.
that was that.
Well, we regret the scheduling conflict, Commissioner, and
Do what you
we're-
can. Yeah.
I was happy to accept that on your behalf.
Thank you.
Thank you.
Well represented.
The last update that I wanted to give you all, I think this might be a record short meeting this morning, is on our CaseWorks project. Earlier this year, you approved entering into a regional project to implement a new electronic document management system for social services. Happy to give an update on where we're at. We're really all hands on deck right now in terms of preparing for this monumental shift. We have designated QA or quality assurance teams across all social services units, including adult and home and community-based services, behavioral health, children and family services, as well as our economic assistance teams and healthcare programs. These QA teams include supervisors, case managers, case aid, or office support staff, so that we have all aspects of our business process reflected in the planning for this transition. QA team members participate in weekly status meetings to stay on track with all of the components of our project timeline and schedule, and this includes QA teams throughout the region. So we have the benefit of learning from other counties that are on the same project implementation schedule within the region.
Great.
Economic assistance and healthcare programs is our phase 1 of the project. Where we're at presently is in the business process and form review. So documenting what step 1 is from a document coming into our agency, whether that be via mail, via fax, email, or residents dropping off documents at our front office, how that gets from the reception desk to the scanner to the worker who will ultimately be processing that information, that application, or that verification. We are also working in coordination with our IT department, both here at Cook County and at Candy, Ohio, who is hosting the server for this project. Data migration is complete for our current electronic document management system in OnBase to migrate that over to the new system. We are setting up integration with MN Benefits, which is a statewide online platform for applying for SNAP, Supplemental Nutrition Assistance Program, Cash Assistance, and Child Care Assistance Program, so that at the point that a resident files an application, indicates that their county of residence is in Cook County, that application is automatically uploaded into our electronic document management system so that it can route to workflow to be processed by one of our staff. For social services, we're a few weeks behind in that process. It's this is the planned approach, is to that we're a little further back in the timeline with social services. We're still working through some of the technical components of the project, setting up VPN tunnels from Cook County to Candy, Ohio. Don't ask me what that means. It's a way to communicate the data across our servers and systems. We're also setting up data downloads from the state so that we have that integration with our state systems, including SSIS, or the Social Services Information System, so that, again, at the point that a resident is dropping off, maybe it's an application for social services or some court documents, that at the point that our staff member enters their name, their date of birth, all of those other fields associated with their case auto-populate from that state social services information system, and it can route to the appropriate caseworker. We are also completing reports on the number of users, the programs they work in, for setting up that access via our user matrix. and starting to plan to prep for our paper files to be uploaded and scanned into the new system as we prepare for this pretty monumental shift
Yeah.
for our social services programs.
Yeah, statewide.
Yes, and that is a benefit, Commissioner, in that we do, not only is this a regional project that we're moving through both for social services and our healthcare and economic assistance programs, but that CaseWorks has already been implemented in over 50 counties statewide, so we have the benefit of following a well-worn path in terms of making our county systems fit this new almost statewide system for document management. So it's a big lift, as you might imagine, for our stretch team to be undertaking a big project like this. It's a big investment of time and effort to get ready for a completely new way of doing business in the case of our social services teams. But my sense is that people are able to see the other side and the benefit that this will create in terms of efficiencies, standardization, fillable smart forms, so that will create a huge efficiency in filling out some of these DHS forms where it can auto-populate with all of that information that's already been registered in the state system. Electronic signatures will be a huge improvement, both for our staff in signing documents as well as the folks that we serve, having the ability to submit those online forms and reducing the instances that they need to come into the office or email or fax documents back and forth.
Wowzers. How is it going with the waiver? I haven't, like the off for over COVID, getting the economic assistance and all that transition, kind of on-ramping again or off-ramping in the waivers. How is that process going? And of course, we've had staff shuffles with that too, so. But throw that into the mix, right? I mean,
Yes, a big project like this, while we're seeing our largest workload ever in economic assistance and healthcare programs in particular, it's safe to say that our staff are treading.
Yeah.
Not quite underwater, but we're getting there. That's close.
Commissioner Storlie.
So it just came to my mind when you said that you have everything in the system and it will populate with the system. Is that kind of like another form of AI?
Not necessarily. It's connecting the data that has already been entered in the state system to our record management system.
Okay.
So what that looks like is we have a daily download of data from the state. That's one of the technical components that we've had to set up in advance to share our credentials with this regional project, so that when we're entering an intake for a new individual or family requesting services, we're entering all of that demographic information, their date of birth, their social security number, their address. So once that's registered in the state system and we have this daily download in place, when I enter someone's name or their case number, on every form that I complete, it will auto-populate with all of that information. So I'm not having to manually type in an address every time I'm sending a notice. It's automatically connected through that state interface.
Sounds slick, as long as it's there.
That's the goal, yes.
Right.
On the other side, we hope to see some major efficiencies.
And I don't know if you should quote me, but I believe tunneling is when you have two encrypted, basically an encryption between two different systems. So you can portal in and it's a secure channel for communication. So, Any other questions for Allison? Thank you. Really exciting and I'm sure overwhelming at the same time. Well, we have no items for board action today, so yes, short meeting indeed, potentially here. We can move on to our committee reports, and we'll start with the Active Living Steering Committee. Commissioner White.
Well, and all of these things, the Active Living Steering Committee, the AEOA, and Arrowhead Health Alliance, excuse me, I reported at the last meeting about the Active Living Steering, oh, that's way down here yet. I reported on these before, and we've had very low attendance at the meetings. The AEOA has not met since the last time. nor has the Arrowhead Health Alliance Joint Powers met. So,
Okay, thank you. We'll move on to ARC. Commissioner Johnson, I see the report was included. Thank you for that.
And that meeting is on Friday again.
Okay, thank you.
Nothing new there.
Okay, thank you. We have our Child Care Solutions Subcommittee. Commissioner Storlie.
Yes, we had a good meeting on Wednesday preparing for today, so we'll all be impressed.
Yeah.
Put it that way.
Stand by. Thank you. Community Health Board, I have not, we have not met. The Cook County Local Mental Health Advisory Council, Commissioner White. Oh, I'm sorry, Rana,
All right,
you're the primary
okay.
reporter.
We had a good meeting, and we talked about some of the same issues with new staff that Allison has brought up here. You know, people are applying, and that part's going well, except for maybe sometimes getting people to actually follow through. We had, let's see. Grand Portage Human Services had a children's mental health training day and kids' day scheduled that went very well. They're doing a lot of things there, which is great. And I don't know anything. Andrea talked about the community prevention and highest needs in this for vaping and cannabis use and things like that, and the coordinating with the schools to make sure people are getting what they need, people are being trained, and really a lot of good things going on to actually be talking about these things and working on them, especially with the school staff, although, you know, there's always everybody's busy, you know, how can you really do some of these things, but I think it's very, very, very helpful from my perspective that's going on. And harm reduction supplies, Narcan, things like that will be available in different places that'll be accessible for people in the community. And I don't know anything else that.
Yeah, thank you, Rana, for the opportunity to mention an update that I should have included in my report, and that is that regional needs assessment is underway within the Arrowhead. Professor Lynn Gert from the University of Wisconsin-Superior was up here last week, conducted a focus group meeting at North Shore Health with representatives from our healthcare and behavioral health system. We have been promoting the online survey, both for providers of service and consumers of behavioral health service, or individuals who have been impacted by the behavioral health system. Internally with our staff, we'll be circulating that more broadly with community partners. We've posted on our social media site so that other community members can help promote that opportunity to give feedback on the gaps and opportunities within our local mental health system and within the region as a whole. Thank you.
One thing that I don't think I've shared with all of the board here that caught my ear recently, I've been trying to share it just with different groups that I've been participating in, but I was listening to the radio and it had Native Voice One, the Native American radio station, and it was a session. It was a neuroscientist. I don't remember if it was John Hopkins or some big D school out east, but it was about we all know about ACEs, adverse childhood experiences, and the impacts that they have both on children and people, I guess, in general. But now they're and we still need to learn a lot more about that and bring more awareness to that. But now what I found really interesting was BCEs, which are benevolent childhood experiences, and the research that's being done on that. And I wouldn't say reversal, but the healing that can happen with benevolent childhood experiences. And it's as simple as building community, having a safe adult that you can trust and talk to, having a team, or working towards something, being hopeful for something, and just enjoying something. All of these are benevolent childhood experiences, and what they're finding is having those can really reverse, or again, maybe not reverse, but help heal those adverse childhood experiences. And maybe it seems obvious, but I think the more data we can get on that, the more targeted we can be and the more good we can do. So it was really exciting to hear about that, and I'm hoping it takes off kind of in the mental health realm, so we can take more actions and do more good. Of course, we want to prevent ACEs in the first place, but that's not always possible, and so what can we do to move on beyond that? I think it's really important. And so whether it's programs through restorative justice or just Cook County sports, supporting our schools and the activities that they do, there's just a lot of opportunities. So I'll try to find that. I'm sure it's recorded and streamed, and I can send the link to Allison as long as I can write a reminder to do it. Thank you. We'll move on to the Restorative Justice, Commissioner Hawkins. Johnson.
That one is meeting tomorrow, and I just realized I had planned to attend. It is a Zoom meeting. You're my alternate.
I'll be gone.
Okay.
Sorry. But someone should go.
If anybody, you'll be there. So, just,
Okay.
sorry I didn't ask you prior to the meeting. It just dawned on me I can't make the Zoom tomorrow after
Nope.
all.
Yeah, no apology needed. Thank you for inquiring. We'll move on to the Council on Aging, Commissioner White.
Yes, I reported on that at the last meeting. They have all of their grants completed. The Otto Brenner is done. They still need 2 board members. They are planning their fundraisers again, and that's about it.
I have a
Doing well.
question, Commissioner
Yeah.
White. For the public primarily, what geographic areas need to be filled for those board members?
It would be one that's out on District 1,
Okay.
and I do not know who District 2, I do not know what district in particular. But District 1, I do know that she has moved,
Okay.
so
Are they district specifics?
I don't,
They
They
try
try.
to get
Sure.
representation
Sure.
throughout each district.
but they really do need to have 2 more people at the table because it's a working board, and and it's summer, and they have businesses, and they could use the help. And it's a good board. It's a wonderful board to be on if you want to really participate in something that's very positive.
I caught the update at the board meeting that you had said there was discussion or questions about ownership and organizational things, and the Brady's perspective was really helpful, and I was just wondering more about that conversation. I've heard kind of periphery questions about like the Public Health and Human Services grant going there and regularly, which is extremely important, but just also some of those financial struggles, or struggles is too strong a word, financial challenges, kind of the uphill battle that's always faced there, and just questions about, is this sustainable? Are we really thinking through this, both with the struggle of membership as well as the finances, just where things are going to go? And I don't know to what level the Council on Aging is talking about that. Is there?
Well, they're different. I had asked that because you had brought that up, that
Yeah.
there was some, should they be folded into the county? And it's like, no.
Oh, okay.
No, they are independent, they are self-sustaining, and
That seems.
and it's not easy, but they control as one can control anything in life. But they have their programming, they have their strategic plan for going forward, and and the usage of the hub is only increasing.
Yeah, absolutely. Our population is aging. That's,
Well, but it's not just the aging population,
Oh, good.
it's the food program that is from AEOA.
Mm-hmm.
Though the numbers have been down recently, many people in this community depend,
Mm-hmm.
have to, on a $4.50 meal, well-balanced meal.
yeah.
And they have, besides taking it to their homes, people can come and pick it up also.
Yep.
And they also have, and I need to connect with Grand Portage, they have extended, the offer to load up whatever meals they would want in Grand Portage and get them up to Grand Portage. They would freeze the additional meals because they know there are people there, rather than having to carry, or food, and then food distribution also, that they could get it loaded onto the bus, because the bus goes up there.
Yeah, thank you. I'm pretty familiar with the food system, and
Sure.
it hasn't changed a whole lot in the 6 years that.
No, it
Okay.
hasn't, but the number of people that come down there and actually eat and enjoy the social opportunity has increased.
Yeah, that's awesome. That's great. I guess I was more interested, and you said it's self-sustaining, but my point, I guess, was that if it's dependent on grant funding and they're struggling with board members being there and going for those grants, I don't know that I would call that self-sustaining. That's walking the line, right? Like, is this self-sustaining is what my question is. So that's why I was like, okay.
Well, the question is, how many years have they been an organization like this? And they have,
20, it sounds like, yeah.
and they've done really well, and it's even more important now than ever before. And
I'm just trying to think ahead, right?
And what value, besides money, would the being part of the county under the not the control is a negative thing, but under the oversight of a county, how would that improve what they do besides money? I mean, it would take the strain off of what's going forward, but they are looking for a grant writer,
Right.
someone to go out after more grants.
This sounds familiar to me.
Well, I'm sure of that. But in
No,
this-
it's an important aspect of many of our community organizations, as well as our organization here, is that grant writing aspect. Much with the highway department, it's mind-blowing just how much is out there if we have someone who can do that,
who can
right? Yeah,
who can pursue it and successfully get
Right.
the funding.
exactly. So I'm thinking of the community center as another organization where, it's U of M extension, but we've got county in there and that kind of relationship dynamic. And I'm just looking at, okay, if the hub is full steam ahead and sustainable and good to go, healthy, awesome. Don't need to change anything, but what I'm saying is looking ahead, kind of looking at our population, looking at the challenges of all of our nonprofits, just wonder, and knowing how much we do already provide funding-wise, just if this is the path to continue on, or if there could be better use of resources integrating, or maybe not, but those are questions that were coming from the community that I was like, those are really good questions that I don't know the answer to, and no one does because it's the future. But just trying to think where our
So are you suggesting that perhaps
vulnerabilities
the
are.
grant funding from the county should not be heading towards the hub?
No.
Okay.
Is that what you thought I was getting at?
Well, I don't know.
Oh, I thought I made it pretty clear that I'm just looking for a sustainable,
For their welfare, for the hub's welfare, perhaps.
the community at large, but yeah, I mean, I know there are challenges, and you had mentioned the board member challenge, and that's been ongoing for a number of years, and so when, say, a board member or a past board member comes to me and says, hey, we need more county involvement, it makes me think, okay, well, I'll ask about that and see, so. But if, like I said, if they're feeling like they're going great, full steam ahead, got the resources they need, I don't need to push anything. That's what the goal is, right?
Right, and David, I would invite you, this is being pretty bold, to come to one of their board meetings
Yeah.
and speak to them
Yeah.
about this.
No, I
About
will.
what you've been hearing, and get their firsthand perspective.
Yeah, no, that's a great idea. I'll do that. Thank you. Thank you. We have Emergency Preparedness Committee, Commissioner Sullivan.
So we have not met this month, but one of the things I've been doing for emergency preparedness is working at lake associations and different kinds of organizations to kind of spread the information about the upgrades to the website, the QR code for evacuation that will be going live soon, talking about different aspects of emergency preparedness. In the event of fire, also talking about with air quality, now that we're seeing some of that Canadian wildfire smoke come down again. So just in the last week, I met with the Devil Track Lake Association, the Cook County Council on, or Cook County Coalition of Lake Association, and the Mid-Trail Property Owners Association. And then on Wednesday, we'll be at the Gunflint Canoe Races distributing information. So getting people ready again for things going live on our website and helping them to get through the smoke right now.
I thought I smelled it
Yeah.
just yesterday. Thank you. Healthcare Planning Committee, Commissioner Storlie.
We did not meet.
All right.
Next month, I think.
All right.
NACO, okay, I'll go right into that. They're meeting in Miami right now. So ahead of time, I did submit some thoughts about some resolutions. And when it's all over and done, later on, they'll send out a report for those of us who aren't there.
Thank you. Yeah, our Department of Children, Youth, and Families meeting was canceled because everyone was at NACO. It was really interesting to see. I just assumed, oh, maybe like, Commissioner Cascaden will be there, or one or two or something. No, everybody.
Everybody. Well, this is the preliminary to preparing for the legislative session in Washington DC in February. So
Yeah.
that's why there's some people who are, everybody's there, and
Yeah.
then some send a delegate to represent
Sure.
them, and then I'll represent you someday.
Yes, thank you. Thank you for your work there. Northeast Minnesota Office of Job Training, Commissioner Johnson.
We haven't met since the last meeting. That meeting's next week.
Thank you. North Shore Collaborative have not met. And Public Health Human Services Advisory Council, Frank is absent today. Commissioner Johnson, is there anything you'd like to, or Allison, do you want to, or the both team?
I think what we discussed is what was in Allison's report today.
Great.
Had pretty light
Anything new?
attendance at the meeting, and provider reports, community roundtable updates. We will be presenting our preliminary budget to the advisory council at our September meeting. That's one of the statutory requirements of our Public Health and Human Services Advisory Council, is that they make a formal motion regarding the department budget for the next year. But yeah, I can't think of anything else that came out of that.
Okay. Well, all around a very light meeting here today. So down to, let's go to the order. I don't know if I've shared with you, but benevolent childhood experiences. No, I did share that already. That was a joke. Future meetings, dates of note. We have our August 6th at 8:30 a.m. I will not be available, so I'll be leaning on our vice chair for that preliminary budget presentation. And I'll play catch up on my return and let you know if I have any questions there, but I've had some sneak peeks in the past, and thank you for taking that on.
Absolutely.
And then we're at adjournment.
Okay.
We're adjourned. Thank you.
Thank you.
This must be a record short meeting, huh?
Yeah.
Yeah.